To Ms Stephen-Smith.
Thank you, Madam Speaker, and I'm pleased to rise today to acknowledge the ACT's public health workforce and the incredible work they do each day for the Canberra community. Health workers are truly the lifeblood of our health system in the ACT. There are more than 10,000 people who work across Canberra Health Services, ACT Health Directorate and Calvary Public Hospital, Bruce. They are a significant part of our community and our public service. From the direct care of consumers in our health services to the work they do behind the scenes to ensure our system serves Canberrans effectively, this is an opportunity to recognise them for all they do. We know the past 2 years have been simply extraordinary. Our health system has faced unprecedented pressure. Our public health workers have made incredible changes as they responded to the COVID-19 pandemic to keep Canberrans safe. They've worked tremendously hard and they continue to work through the issues that confront us every day as a result of this once-in-a-lifetime pandemic. Fingers crossed. We have now reached more than 2 years since the first case of COVID-19 in the ACT, and through this time, health workers have shown incredible resilience in the face of the pandemic's challenges. They've built up our service capabilities so that we can be ready to respond effectively to further outbreaks as and when they occur. Health professionals engage with our community throughout our entire lives, from birth to the very end. The ACT Government respects and appreciates our health professionals, our nurses, doctors, midwives and allied health professionals. We listen to them and we support them. That is why we have committed to employing more than 400 new doctors, nurses and allied health workers in this term of government. These additional staff will bolster the Territory's workforce and provide high-quality care across the health system. Recruitment of our health professional workforce is integral to our health services. That is why we have absolutely committed to bringing on board more health professionals. Our health services are constantly changing with rapid developments in new technology and more sophisticated and effective interventions and models of care. We know that our region is growing and changing, which is why we're ensuring every opportunity is taken to support our health workers now and to prepare our future workforce needs. Of the commitment we made to employing 400 new health professionals, the ACT Government has already funded 257 full-time equivalent positions in the 2021-22 budget. We fulfilled over half of our commitment in one budget, delivering an important boost to our health workforce that we will continue to build on through this term of government. So far, our health services have recruited more than 170 of the funded FTE in this financial year up to February 2022. That means more staff on the ground to support our community and one another. Our investments in the 21-22 budget include more services at Calvary Public Hospital, Bruce, of which one is the commencement of 24/7 medical imaging with more allied health, nursing and support staff. This service started on the 31st of January 2022 and is increasing patient access to medical imaging and decreasing staff fatigue with more health professionals joining the service. The 21-22 budget also invested in even more capacity for both our emergency departments, including new models of care and positions to better support Canberrans when they need to attend the emergency department. At Canberra Hospital, significant recruitment has been underway and we've reached some of the highest levels of medical officer coverage in the ED at the Canberra Hospital in many years. Some of the changes in the way the ED operates and its interaction with the rest of the hospital will take time to embed and mature. And this is compounded by very high presentations across both EDs in recent weeks. But with more staff and a real commitment to change, Madam Speaker, I am confident we will see improvements. Not for the sake of the numbers, but because those numbers are people and we want to ensure that patients are safe and improve their experience in accessing emergency care. To support our health workforce during the pandemic, there has been significant and ongoing recruitment occurring across our health system. There have been high numbers of health workers needing to quarantine over this pandemic, and this has been the case for workforces across the country. The government has worked hard to make agile changes to respond to the pandemic's impact on our public health workforce, with a number of initiatives being progressed, including more than 750 nurses and midwives recruited in this financial year, junior medical officer and nursing graduate intakes brought forward to join our teams early, more new graduates recruited than ever before, the introduction of a health student workforce to our testing and vaccination services, and stronger health and wellbeing support programs to support both managers and teams through this difficult time. We know it is still hard for our staff right now. Our health services continue to work through every option available to ensure our public health workforce can do what they do best, and we will continue to do this work with and for our health workforce. At the 2020 election, we also committed to mandating minimum ratios for nursing and midwifery staff at Canberra Health Services and Calvary Public Hospital, Bruce. I was pleased recently to mark the first phase of the nurse-patient ratios framework being implemented in our hospitals, taking a crucial step forward in commencing ratios in the ACT. With more than 50 of the 90 FTE nursing staff brought on board to implement ratios, there has been significant progress in ensuring we can meet the nurse-patient ratio that will increase support staff and patient care. We are just the third jurisdiction in Australia to mandate nursing and midwifery ratios, and we're incredibly proud to be joining Victoria and Queensland in implementing this very important initiative. It is a true Labor commitment that reflects our core values, that shows respect for our health workforce. It is also a reflection of our commitment to work collaboratively with the unions that represent ACT public sector staff, in this case the Australian Nursing and Midwifery Federation ACT branch. They have driven this initiative and I thank them for their important advocacy. Recruitment and implementation is ongoing at the moment, but I look forward to seeing the full implementation of this commitment and meeting the many new nurses that are joining our teams as part of this work. The implementation of the nurse-patient ratios framework will result in many benefits to the Territory, including better patient outcomes, improved patient satisfaction, reduced length of hospital stay and reduced inpatient mortality. The guaranteed level and skill mix of staff on each shift will improve management in the care environment and improve job satisfaction, which also contributes to a sustainable workforce. Looking to the future of our public health workforce and ensuring we have a sustainable plan, the ACT Government has initiated development of a health workforce strategy and plan. This work, being led by the ACT Health Directorate, will enable long-term workforce planning to occur in a structured and informed manner. The ACT Health Workforce Strategy will outline the health workforce priorities and key initiatives that will guide the development of our ACT public health workforce into the future. This overarching strategy will incorporate and refer to national, local and profession-specific workforce plans and frameworks to ensure we are sustainably planning for and growing an effective workforce that can meet the needs of Canberra and the surrounding regions. In parallel, our health services are completing essential workforce planning at the local level to attract, recruit and retain staff for the future. Canberra Health Services has developed a nursing and midwifery workforce plan 2022-2023, which is due to be published in mid-April. Recruitment planning has commenced at for the Canberra Hospital Expansion Critical Services Building, due to open in 2024, with a further commitment announced today. And the ACT Health Directorate is establishing an ACT Allied Health Workforce Framework to guide and track relevant activities from public sector allied health services that contribute to a robust workforce. Unfortunately, we also know that there are national shortages of trained health professionals in some areas, such as midwifery. Both Canberra Health Services and Calvary Public Hospital have workforce strategies in place to mitigate this and to attract people to join our health services. These include targeted programs in areas of need and stepped approaches to assist health workers to gain qualifications. Finally, Madam Speaker, I'd like to touch on the importance of primary care and an integrated health system. We know that the health system is made up of health workers across many areas of the community, and we recognise that there are considerable pressures everywhere. Often the first interaction a person in the community will have when seeking healthcare is in primary care, most likely a general practitioner, but possibly a nurse practitioner or allied health worker. From there, they may have a number of contacts with other health services, and it is crucial that our health system is effectively able to integrate so that everyone can receive the right care at the right time and in the right place. I'm sure I speak on behalf of every member of the Assembly in expressing again my sincere appreciation and thanks to the Territory's health workforce for everything they have done and their continued hard work during these difficult times. I present a copy of the statement and move that the Assembly take note of the paper.